The Health Leadership Panel has been a wonderful opportunity to engage with the community, to think about different ways that we could affect and implement new ways of going for health. I think that's really important, and I think the reason that we need to do this is because La Trobe is a leader in health.
I think there's lots of research which can impact on everyday Australians, including how does the health system work better, how do we actually get better access, how do we actually get better quality, how do we get better efficiency of the Australian healthcare system. What is the effect of a co-payment, for example? How do you improve quality of care in Australian hospitals? So that sort of research impacts in Australia, and it's the research that can only be done in Australia, so we need to be doing more of it.
Burnout is a particular issue for all health professionals, and particularly with allied health and physiotherapy. And there's a lot of research that actually talks about certain types of programs, training, support that we can give to our staff to help prevent burnout. So things like making sure staff feel empowered in their roles, providing them with emotional intelligence training so that they can actually deal with some of the difficult aspects of their jobs and their interactions with their patients means that we can actually prevent burnout and have people working longer within their roles.
Hopefully we can take a lot of refugees here. I'd love to see a great cohort of people taken and give them a better opportunity in life. They will need to be assessed according to individual needs. Just as important as health needs is housing and education. Personally, I think we should steer away from the American system, which is based on how much money you have, and go more towards the Scandinavian system where there are very few private hospitals.
I think the incremental changes that we can make are in our control, and I think that that's very positive. The Australian system is a pretty good one. We'll always try and improve it, but I think the takeaway message is that we're doing a pretty good job actually. There are a lot of issues, but we can do something about those.